各位朋友，大家好，我係 Michelle 朱曼舒，歡迎大家收睇我哋今日嘅嘉賓訪談嘅。嗱，好多時咧，我哋嘅節目咧都會帶俾大家一啲醫學嘅常識嘅，咁啊，今日嘅節目都唔例外啦。咁啊，大家有冇聽講過咧？有一種嘅口腔嘅疾病咧，係叫做 burning mouth syndrome。究竟呢個係一個咩嘅名詞啊？係咩意思咧？嗱，今日咧我哋咧係請到咗牙醫咧係 Dr. Richard Thomas 上嚟咧同我哋咧係講下呢方面嘅常識嘅。係 welcome Dr. Richard Thomas。
Thank you for inviting me to our TV.
Yeah，thank you。咁啊，阿牙醫 Richard Thomas 咧就係今日咧會同佢講下啦。So can you explain so what is the burning mouth syndrome?
Burning mouth syndrome is a feeling where there is a continuous burning or irritation in the mouth without any apparent cause. The source of the condition is often idiopathic or unknown.
咁其實咧咩叫做頭先講嘅呢個 burning mouth syndrome 咧？咁其實咧就係 Dr. Richard Thomas 呢話，有時呢啲病人咧會突然間覺得佢嘅口腔入邊咧就會好唔舒服，有啲痛啊，但係唔知咩原因產生嘅。咁其實咧佢哋好唔知道自己原來咧係得咗呢一種嘅叫做 burning mouth syndromes. So I want to know what kind of person will suffer this burning mouth syndrome?
Generally, the sufferers are elderly, middle-aged people, with the largest group being comprised of primarily perimenopausal or postmenopausal females.
即係就話咩人會有呢一種嘅問題咧？嗬，咁有時咧就係會頭先佢講到啦，可能係年齡啦，年齡嘅增長啦，可能有啲嘅老人家咧，佢好容易有呢種嘅問題嘅。同埋咧，有時係女性咧都要小心啦，即係可能係呢一個差唔多到更年期啊，或者更年期之後咧，啲女性咧其實咧好容易咧係得到呢一啲嘅呢個 problem 嘅，就係叫做呢個 burning mouth syndrome 嘅。So what kind of sign you will find out? So what's the sign for this burning mouth syndrome?
The most common sign is a burning sensation in the tongue, lips,
Tongue and lips?
or palate, the roof of the mouth. Often there's inadequate amounts of saliva. The mouth is dry, there's dry mouth. The condition sometimes occurs and suddenly can be associated with trauma or a recent dental visit.
So you mean sometimes recently you have some dental treatment, you may have this kind of problem?
The patient often reports it after that,
Oh,
that
I see.
they have the symptom. Although there was no injury during the treatment, they report that they have a burning feeling in their mouth.
咁其實咧係有咩嘅象徵啊？即係你有咩感覺會覺得有呢一個 burning mouth syndrome？有時咧有啲病人咧去睇完呢個牙醫做一啲 treatment，但係佢其實都冇受到傷，但係之後佢都翻去同個牙醫咧投訴，就話佢覺得個口腔有時可能係so the lips 喂個嘴唇啦，或者係個條脷啦，或者係個上顎嗰度咧會覺得痛嘅。咁如果你有呢種嘅情況發生咧，你一定就要去睇醫生揾牙醫 check 一 check 啦，會唔會係屬於呢一種嘅 burning mouth syndrome 嘅？咁啊，另外如果係得咗呢一啲嘅病咧，其實醫生點樣去診斷佢究竟係咪屬於呢一種嘅病咧？How you can diagnose so whether they they have this burning mouth syndrome? How do you diagnose it?
Often a change in taste or a phantom taste is often noted. So they taste something that's not actually there. Could be sweet or sour or bitter, but there's no food in the mouth. Pain can be lessened by chewing on gum or eating. Sometimes continuous burning of the tongue, lips, or palate continues even with eating.
Oh, really? So it's very strange. So you mean sometimes when they chewing the gum, they will feel better?
They will feel some relief
Oh, they
under
will
eating,
feel some relief.
and sometimes no change happens.
咁其實咧，即係點樣個醫生點樣去診斷佢有冇呢一種嘅problem 咧？So you're talking about the symptoms, right?
Yes.
You're talking about the symptoms. That means if the patients sometimes they have a very strange feeling, strange taste,
Yes.
and then maybe they have this problem.
Yes.
So 咁其實咧，佢都係講緊呢個象徵咧，仲有其他一個有時候呢啲病人咧，佢會其實個口入邊咧係冇食到嘢啊，但係咧佢會有個感覺咧，覺得好似自己食咗，所以好似覺得自己食咗啲酸嘢啊、甜嘢啊，或者係覺得係苦㗎。其實如果你有呢種嘅，即係呢種唔係個幻覺啊，而係有呢一種嘅情況出現咧，同埋有時你好似覺得食一啲嘅即係有啲金咧，即係嗰啲香口膠啦嚇，咁食咗之後咧可能會覺得舒服啲嘅。咁有啲咧就算係食咗都唔會舒服。咁其實咧呢個都係佢一個嘅 symptom 嘅。So okay, after we talking about this symptom, so I want to know, being the dentist, how do you diagnose? So So how does investigate? How do you investigate this problem?
A careful review of the patient's medical history and social history is made
Yeah.
for diseases and disorders. And then sometimes laboratory tests may be performed on the soft tissue to see if anything comes up that shows that something is abnormal.
So okay. So you mean like you need to take some tissues out from the patient
Sometimes the
to
tissue
do some tests, right?
sometimes that is done.
咁其實咧，醫生咧，如果係發現你真係有咁嘅 problem 咧，佢點樣去呢一個做進一步嘅調查咧？佢點樣去 investigate 呢一個嘅 problem 咧？咁佢可能咧要喺你嘅口腔咧係抽取一啲嘅樣板，咁啊抽取啲樣板咧去驗咧，咁先知道你係咪真係有咁嘅 problem 嘅。So and also how so you mean sometimes the patients if they are smoking or they drinking alcohol, they also will cause your mouth very strange feeling. So how do you diagnose whether it's the burning mouth syndrome?
First, other conditions with similar symptoms must be ruled out, such as smoking alcohol, like you mentioned, or
Yeah.
Some people smoking illicit drugs like crack cocaine, crystal meth. Some people have allergic reactions, radiation therapy, autoimmune diseases, vitamin deficiency, psychiatric problems. Diabetes has been known to cause that problem, so all of these things have to be ruled out as causes.
So, but how do you know whether it's caused by smoking or caused by burning mouth syndrome?
Often the patient is a chronic smoker. They've been smoking for a long time without these symptoms occurring. So they're not a new smoker, and then suddenly they report this feeling of a burning sensation in the mouth, or a change in taste, pain. So they're already smoking for a long time before, so that usually is not the cause of it.
I see. 嗱，咁佢點樣可以診斷到有時係咪因為食煙啊或者係飲酒係都會有啲唔舒服嘅感覺，定係真係屬於呢一種叫做 burning mouth syndrome 嘅呢種病咧？咁如果你譬如個病人長期係食煙都冇咁樣嘅即係唔會有咁嘅問題發生，咁即係唔應該係由呢個食煙引起㗎啦，唔會由飲酒引起㗎啦。咁佢排除咗好多其他嘅可能性咧，咁醫生會診斷出咧，其實咧就證實咗你咧就係得咗呢一個 burning mouth syndrome 嘅。So is any treatment, can help patients, for this burning mouth syndrome?
Currently, it's a very difficult problem to treat because it doesn't seem to have a cause. So they can often get relief by increasing water intake, rinsing. Some people will suck on an ice cube. And then if they notice that something actually irritates it when they have that problem, drink certain foods, spicy foods, drinking alcohol, smoking, they can stop doing that. Antidepressants have been prescribed for this problem, but with very limited success.
So how long it will last for this symptom?
Sometimes it almost becomes a permanent condition. The person just tolerates it.
Oh, really?
There's no real time frame for it. Sometimes it disappears, sometimes it continues. The person may just adapt to it, but they find it very annoying and very debilitating.
咁佢咧呢一種嘅疾病咧，就係呢一個 burning mouth syndrome 咧。其實醫生淨係可以俾一啲少少嘅藥俾你食咧，令到你舒服啲。但係咧都唔係治根不治本啦。咁其實咧多數咧就要飲多啲水啊，或者係即係有一啲即係幫你減輕呢一種嘅痛楚。但係有啲嘅病人咧，甚至乎咧可能真係一直都會有呢個 problem 咧，都好難解決到嘅。咁所以咧，其實我哋都要小心。So I know you have emergency dental service, right? So I want to know what kind of emergency dental service you will provide for the patients.
So we're offering same-day emergency dental treatment for problems such as immediate severe pain, orthodontic emergency. Sometimes a wire or a bracket may pop off, broken dentures, simple cosmetic repair, beginning of root canal, draining abscess, oral surgery, wisdom tooth extractions. That's general dentistry, something that is of urgent nature that needs to be addressed on the same day.
So that means patients don't need to make the appointment to see you and then they just go into your emergency service clinic?
There are many walk-ins, but we often recommend the patients call ahead of time and let us know what their problem is so we can prepare for this.
咁其實咧就係Dr. Richard Thomas 咧，除咗係普通嘅幫人哋洗牙啊，或者係做一啲牙嘅 treatment 咧，其實咧佢有一個好特別嘅服務咧，就係佢哋有一個嘅係牙醫嘅緊急嘅服務啊。咁即係話佢哋 So what time you open to you know from what time to what time for the
The clinic is open
emergency?
6 a.m. until 10 p.m.
Wow,
7 days a week, 365 days out of the year.
6 a.m. to
10 p.m.
10 p.m. 朝早6點到夜晚嘅10點啊，咁啊一個禮拜咧7日嘅服務啊，即係佢咧呢一種嘅 emergency 嘅口腔服務咧，就即係唔係每個牙醫診所都有㗎，咁所以佢都係佢哋一個特別嘅地方。所以如果大家係譬如突然間有啲突發嘅唔舒服嘅，咁有時我哋去睇牙醫咧，好難 make 到 appointment 㗎。咁啊，Dr. Richard Thomas 咧，佢哋呢個 clinic 咧就係有呢種特別嘅服務嘅。So can you tell us, give us some example what kind of emergency service you served the patients before?
So we've had somebody who's had a fall, a trauma where their teeth are broken, the nerve is exposed. We have stabilized the situation, started root canal on them, and done a simple cosmetic repair so they look better going out of the office than they came in. We've
Yes.
done work where a patient has had their wisdom teeth extracted by another dentist and they're in severe pain a few days later. We've done post-surgical care this way.
Okay. Yeah. Thank you so much. So 咁啊，大家喺熒光幕咧都可以見到啊，Dr. Richard Thomas 咧，佢哋個 clinic 咧就係喺 Bayview 同埋係 York Mills 嘅交界嘅地方嘅。咁啊，亦都見到佢嘅地址同埋電話，咁大家可以直接咧打電話咧同佢哋聯絡嘅。Thank you so much.
Thank you very much.
Thank you. Thanks.